Senator Karen Spilka represents the 2nd Middlesex and Norfolk District, the towns of Ashland, Framingham, Franklin, Holliston, Hopkinton, Medway, and Natick in the Metro West region of Massachusetts. She is the esteemed Massachusetts Senate President, and Senator Spilka, it is a pleasure to have you here today. Thank you.
Oh, thank you, Audrey. It's always a pleasure to be on your show, and it's great to see you. I hope you are well.
I am. Thank you, Senator Spilka. Well, let's go back to March 10th. The governor declared a state of emergency due to the coronavirus. What were the first changes that happened at the State House in response to that?
Well, like almost every other aspect of our life, the coronavirus, COVID-19, changed totally how we did business in the legislature. And I believe that the Senate rose to the challenge in the best way that a several hundred-year-old body could. That very day, I started by creating a working group, knowing that we would not be coming to the State House as regularly as we had been, did not know how long it would be, of course, or what sort of total shape it would take. But I formed a Senate working group, and I had Senator Joe Comerford, the Senate Chair of Public Health, overseeing it, with the chairs of Economic Development, of Healthcare, and several other critical committees on it. And they all took the lead in reviewing bills and issues in their area. This group took ideas, issues, concerns from the public and across the state and businesses, communities, and filtered them up to me, and then we filtered them up to the administration. They looked at existing legislation and other areas of legislation to address the public health crisis in an urgent manner. That was the first issue that we really focused on, the public health crisis. So we acted pretty quickly and swiftly on legislation to help small businesses, our municipalities, help restaurants. We tackled eviction and foreclosure relief. We made tax filing. We changed it from April 15th to July 15th. We safeguarded elections, and we did so much more. I also made my website a source for Metro West related statewide COVID-19 related resources. I produced a weekly video update and I posted it widely on social media to help keep the public informed about what the Senate had done the prior week and then what we were planning on doing the coming week. We passed more than a dozen and a half COVID-related bills. We started holding our Senate sessions remotely. That was the first time in history. We had to get updated with our technology and worked. And now we are multitasking with other issues in economic development, racial justice, our budget, healthcare, transportation, and climate change, among other things.
Well, we have a lot to talk about with all of the work that you and that special committee has been doing. It's been quite a packed few months. So let's start by talking about what Massachusetts is doing to combat COVID. Is the governor and the legislature looking at best practices or what were in other countries that have better control of the spread of the virus? And what more do you think Massachusetts should be doing to combat COVID?
Well, definitely we are looking at best practices both from within our state, outside our state, and within our country and across the world. This is a global pandemic. The Senate, in addition to having working groups, as we felt we were beginning to come out of the COVID, the real spiking in June and July, we started holding listening sessions on our recovery and reopening. So we had special listening sessions on issues related to public health and healthcare, our economic development and job creation, our labor and workforce, our childcare, education, and so many other issues to get feedback from people. So we are hearing from people some of the concerns and issues. I am very concerned right now that we are experiencing a slight uptick.
Right.
I think we need to get that under control, definitely. And if it means us pulling back a little bit, I think we should do that.
I mean, it might be perpetual if
Yes.
we don't really, testing is being ramped up with pop-up testing, and you've been an advocate for that, and you've gotten that in your district, but
Yes,
without mandatory quarantining, with testing can't really stand alone, can it, in this battle? Doesn't it have to be balanced by quarantining?
Well, I think there has to be a lot of things. I mean, I think that testing is a really important aspect of this. And that's why I fought so hard to get one of the free pop-up test sites right here in Framingham. And I was successful from Wednesday, August 5th to Friday, August 14th. At Keefe Tech. I don't know when this will be playing, but hopefully it'll be playing in time for people to take advantage of it. No appointments needed, drive-through, again, free. And within a couple of days, people will have their results.
Right. So it starts today, which is great. And I know it was a battle because when the pop-up sites first were announced, Framingham wasn't on the list. What did it take to get Framingham on the list?
I lobbied hard. I spoke to the governor. I spoke to the head of the command center, the Secretary of Health and Human Services, that we needed, Framingham absolutely needed a testing site right here. And we needed it now, especially as the uptick in positive cases across the state and a little bit in Framingham as well. So this expands the opportunities for testing, especially for folks that were not able to do it before. We also need to really make sure that people continue to wear masks. Clearly, research is showing that is one of the best ways to stop the transmission and prevent it from happening in the first place, combined with social distancing. I know it's been a long haul. We're going into 4 or 5 months at this point, but we simply cannot let our guard down. So the combination of wearing masks, social distancing, washing hands, and then getting tests and making sure that tests are available. If you don't feel well, stay home, self-quarantine. That is really important. So I think we need to keep our eye on the ball of getting that trend go down and keeping an eye on issues around school opening and childcare needs. If we're expecting people to maybe go back to work, we need to make sure that there is sufficient childcare. Childcare and transportation are really critical infrastructure.
Right, and we'll talk more about that too, because those are really important issues. But just in terms of the quarantining, in other countries that have gotten this under control, the quarantining is more mandatory. Is there anything in the future like that for Massachusetts?
Well, I think the closest that the governor has gotten is if you're coming from out of state. Most of the states, except for some of the New England, although Rhode Island as of Friday is also, if you come from another state, you need to quarantine for 14 days or have a COVID test within 72 hours of coming in, a negative COVID test, to make sure that you're not sick. Even if you're a resident of Massachusetts coming back, starting this Friday, that you need to do that. So I think that it's really important that people maintain their vigilance. I think otherwise, I really do feel we're going to have to be pulling back.
I know. Is that even enforceable? I mean, how do you make sure that that side of the equation is balanced?
Well, I mean, in talking to the governor, we are discussing this, but I believe that it is difficult to enforce. We need to ensure that our boards of health have the resources that they need to monitor this as well.
Senator, speaking about that, the majority of the COVID deaths, as you know, were in nursing homes, assisted living facilities, senior housing. When you speak to the people running those facilities, what they say is that they have not been treated the same way hospitals are being treated. They have not been able to get the critical supplies and the support resources that hospitals have received. Why wouldn't they be a priority considering the numbers that are coming out of there?
They are absolutely a priority. I've had many discussions with the governor, with the head of the command center, the Secretary of Health and Human Services, and several weeks ago at the height of the crisis, in really spending a lot of time talking about our nursing homes. They are like little petri dishes of
I
the
know.
and as we know, 60% of the fatalities were from nursing homes. So we put the administration put a lot of resources, developed the whole program just for nursing homes and facilities like that, where they had to have audits, they had to provide certain protocols, they had to separate residences who were positive versus negative, they had to wear their PPEs, they were supplied PPEs, which is something PPEs have become a kitchen table word at this point.
Exactly.
And
Yep.
and they have checkoffs. They have to make sure they are up to par where they need to be. Otherwise, they would not. There was over 100. There was a lot of money, millions of dollars set aside just to help the nursing homes. The first time around, they got the funds, and every couple of weeks, in order to get that extra funding, they needed to go through this audit and pass it and certify that they were meeting all of the requirements to help reduce the COVID-19 cases in their nursing home. Most of them did it. I think this past week it came out that thus far there are 3 nursing homes that have failed to meet those standards, and the administration is looking at taking actions against them to protect the health and safety of their residents. So there has been a lot of action. Again, this has been a pandemic that all states are working on, and it's been moving so quickly, unfortunately.
It really has. And now the legislative session started on January 2nd, 2019, the current session, and it ends officially on January 6th of 2021. But the formal session would have typically come to a close on July 31st. So typically, nothing's typical right now. Where does that stand right now, August 5th?
Okay, well, yeah, as you mentioned, the legislature has a 2-year session. The first year we're in formals, we meet, we debate, and we have informals where we still continue to pass legislation. But usually in the second year, on the evening of July 31st, 12 p.m., midnight, we end our, quote, formal session where we debate controversial bills and stuff. And that's for several reasons. People sometimes ask me, why do you do that? Number one, I want to stress we still continue to pass legislation in August, September, October through the end of December. We will continue to pass legislation, just not controversial bills. This was started back in 1995 when there was a lot of outcry over the legislature passing bills that were considered through lame duck sessions. When people, because our elections are coming up, we have our primaries just on primary day, September 1st, and our general on November 3rd. That's when we will all be reelected or not, depending upon the voters. But if somebody is either not running again or not reelected, but legislatures pass bills, there was a big hue and cry against that we should not be doing that in lame duck sessions, so to speak. So, and then people need to get out and campaign. If a senator or a representative has a primary on September 1st, they need to be out there, however they can now with COVID, but they need to be campaigning. And if they have a general on November 3rd, the same thing for September, October. It's only fair for them to be, continuing to do that. So for all of those reasons, that's why it's happened. However, as you mentioned, we are not in normal times. So because COVID-19 took so much of our attention in March, April, May in particular, we along with the House, decided to extend our session. That is unprecedented. This has never happened in the history of the Massachusetts.
And is it the formal session that you've extended?
Yes, because we have to, under our Constitution, meet in informal sessions twice a week, basically.
So when did you extend the formal session to?
The end of the year. And so we need to continue to focus on the budget and do a full year budget probably this fall, once we get the factors of the federal money, our funding, our revenue, because we put off our taxes, and see what the fall looks like, if there's any resurgence of COVID-19 in terms of healthcare and the health of our residents and our economy and jobs. So
if you want to talk about the budget now, let's just start with an overview of what's the current financial state of the Commonwealth.
Well, we've heard from a lot of the experts, and I realize this is still all guessing because nobody knows, but we have an approximate 44 billion with a B, $billion budget. They are predicting somewhere between $6 to $8 billion revenue loss for this year, which is fiscal 2021, from July 1st to June 30th. We are still at a 17% unemployment rate, one of the highest in the country. I can't ignore that. I need to make sure that we provide for our residents and yet don't put an additional burden on them. So
do we have reserves that can help balance the budget? And are they of any significance?
Are what? I'm sorry, I didn't hear.
Reserves.
Well, we do have a $3.5 billion rainy day fund, which most likely we will pull on because I do believe it's going to be raining this year.
It's going to be raining. Yeah.
However, I think the next year, fiscal year 2022, could be even tougher. And I'll explain why. So we need to save some of our money, just like in a family. If you have a little bit in a savings account and you know you're going through hard times, you like to spread out pulling from that savings account and not doing, exorbitant things. So we need to see what the federal government, we had a couple of federal assistance bills, revenue bills that were already passed. For example, the CARES Act, they call it the CARES Act, which was signed into law, gave Massachusetts about $3.6 billion.
Has it been received?
Most of it, yes. Some of it going to cities and towns, some of it the state, but there's a lot of strings attached on that. We're hoping that the next bill loosens it up. There were more strings attached than any other federal revenue bill in any other recession. So, recently for this big second bill, the U.S. House of Representatives did what they call the HEROES Act, which, if that act became law, Massachusetts would get $10 billion. $10 billion. I just mentioned we are probably between 6 and 8 billion in the hole. Right. If we got 10 billion, we would be in okay shape for this year financially. The Senate, on the other hand, U.S. Senate, is looking at a smaller bill, a smaller revenue bill. So if we got somewhere in between the original CARES Act at 3.6 and the 10, even if it was for 5 billion, we would be in better shape, and then maybe using some of our rainy day fund and some, other areas, we would be in much better shape.
At least for fiscal 21. I mean, fiscal 22 is another whole challenge.
If we got the 10 billion, clearly we could sock some money away for fiscal 22 to help, because as we all know, recessions usually take more than 1 year to catch up and disappear. So we need to see, it's impossible for us to know what our federal assistance will be. So we need to get a better handle on that. We're hearing it could be within the coming weeks. So we're waiting to hear that. So we did another 3-month budget to take us through October. We also need to know what income tax revenue we have. We've extended the income tax deadline from April 15th to July 15th. We won't know until sometime, another week or two as to what our income tax taken for the state was and what our revenue picture is. As I mentioned also, the third major factor is such an unknown, and that we mentioned before, what is happening with the coronavirus, with COVID-19. God forbid we have a spike again, or even worse, we become another, state that has a higher rate. We need to, and this is why it's so important to get a handle on this and make sure that that trend starts going downward, because it will have a very big impact on our healthcare costs again, just like it did March, April into May. And our economy, if we have to start, closing down businesses again, or, job loss, that would be clearly a terrible scenario for the Commonwealth. So we're hoping, and I think, I'm glad the Baker administration is, and we are in touch several times a week, keeping track of the numbers, the healthcare numbers, the data is and should be what is driving us.
That's why I keep asking you about the mandatory quarantining, because I see what's being done on the testing side, but I feel like it's very uncertain on the spread based on compliance with quarantining. And I know that that's a tough road to go down in terms of making something like that mandatory. But when you talk about the impact on the economy of a second wave and the financial implications, it's frightening.
Right. No, I agree. It is frightening. But this is why I thought, and I pushed really hard, coming from a school committee background, I know how important it is for school districts and for cities and towns, the municipal side, to know what their aid is, to be able, so that they can then plan for that year's finances. So I pushed really hard, and I'm glad that the Senate, the House, and the Baker administration made that local aid that we agreed with the commitment to bring the clarity to the school aid and their funding, and bring the clarity to the municipal aid. We level funded municipal aid to all of our cities and towns. And we did what we call foundation plus inflation and enrollment growth. So we funded education aid at what we did for fiscal 2020, but we added another $107 million to that to cover for foundation aids and enrollment. So in the long run, Audrey, that this has been one of the most important issues for me, and I've worked so hard.
Since day one, you've been working on this.
I
really
know that. Hard to bring more Chapter 70 education aid dollars to Framingham, because I know, and we've had so many discussions about this, how for several years Framingham was the poster child of not getting the fair funding. Exactly. So I've worked really hard over the last few years to bring that up to where Framingham should be and more. And so despite the awful economic times, and instead of cutting Framingham School District's education funds, I was able to secure an increase of $5 million for this school year. Just the student opportunity, we have to get the planning. And I just want to add that this is on top of an already $400 million that has come to Massachusetts and been distributed to the school districts because of COVID. So the Framingham and other school districts have gotten federal funds. Statewide, it's come to $400 million distributed for COVID-19 related issues. So Framingham will get, and we will continue. I've been pushing, working really closely with Senators Markey, Senators Warren, and our Congress folks, particularly Congressman Neal, to really push to put in the next round of federal funding more dollars that would go directly to the K-12 education system, directly to childcare, to higher education. This is our future. We cannot lose sight of putting our resources towards these areas and ensuring that our kids continue to get the education that they need and we need as a Commonwealth.
And that's the question of the day. How should schools even reopen? And how do you catch up with the loss of education that happened in this prior school year? And what does that plan look like? That's the topic of the day. There's a lot of uncertainty. There's a lot of angst. And the numbers on COVID aren't quite there yet that give people the comfort level that they need in order to say, yes, I want to send my children to school. What do you think about that?
So I am hoping that school districts and the Department of Early and Secondary Education are helping our teachers, helping our schools, working with our unions to get the professional development that we need so that teachers are ready to do remote learning. And if you keep them at home, then the parent needs to tend to them. You can't have a kindergartner in first grade, second grade, sitting doing this on a computer, teaching themselves. I mean, they need assistance, which if a parent is home working, it's almost impossible to do both or both well or even acceptable. So, I know that it is an incredible and difficult situation, but, I know the Department of Early and Secondary Education, DESE, has asked school districts to prepare 3 scenarios, one in school, one totally remote, and one in the middle, hybrid. But I still am concerned how this hybrid may work and be implemented. I don't know if that means for some districts, some kids in this classroom for the month of September, the other half home for September. Do they switch in October and then do they switch back in November? How do parents work? How do they plan? How do they get childcare? Is there sufficient childcare? To me, childcare is just as important an infrastructure for the economic, workforce as transportation as well. So I'm not certain how this is going to work, and I feel the angst and frustration of parents, teachers, administrators, and our kids. It's really, really hard.
It really is hard. I mean, parents can't go to work without childcare, if school is remote, that raises a whole new challenge for families. And that's why I think getting the spread of the virus under control is the most important thing, because all of these other things fall into line if the proper mechanisms are in place for identifying infection, limiting its spread, etc. There is a statement on your website which reads, Massachusetts has a greater imperative now than ever to lead on issues with real impact on people's lives. So those are really systemic issues, right?
Yes. I mean, I believe that Massachusetts should and can be a leader in so many areas. And the Senate, and I am very proud as the president of the Senate to have worked methodically and deliberately as a whole Senate to tackle some of the really big issues that are before us. We did the education, the Student Opportunity Act. The first year of our session, nobody thought we would be able to do that. I really made that a priority, as we've talked about how important that is. Mm-hmm. And we successfully did that. And I'm hoping beyond hope that we will get back on track with that. We, in November of 2019, did a major prescription drug reform bill that would immediately, if passed, lower the cost of prescription drugs, put us first in the nation in prescription drugs. In January of 2020, we did an incredibly comprehensive and progressive climate change bill. That also would put us ahead of all the other states. February 2020, we did a mental health reform bill that would finally achieve parity between mental health and physical health, and working to reduce the stigma, increasing workforce, access to mental health and behavioral health services. And then
And you said that with the mental health bill, which passed 38-0 unanimously in the Senate,
yes.
that you were hoping that that would make it to the governor's desk before the session was over.
Yes.
Where is it?
Sitting in the House.
Which leads me to one other question I did want to ask you about that. And that is that in Massachusetts, although we have a Republican governor, the Democrats maintain veto-proof supermajorities in the legislature. So if partisanship is to blame for not getting legislation passed in DC, what's to blame in Massachusetts where that partisanship doesn't exist?
Well, I mean, clearly there's differences in the branches, the House and Senate. The House, the Speaker of the House takes a pulse of his members and what gets done. He has his priorities. The Senate, I do the same thing in the Senate. To me, the mental health, behavioral health, I hear from everybody, everywhere I go, how important it is.
So important, yeah.
To increase access, and parity is so needed, so it's treated the same as physical health. That is and will continue to be a priority for me. Just like, last session, we didn't get the education reform to the finish line. We took it up again this session, and we came out with an even better bill than we would have done 2 years ago. I'm hoping the same thing happens with mental health, that we are able.
Yes, so much greater now, even with, I didn't mean to interrupt you, I apologize, but with the mental health issues that are so closely related to the COVID pandemic as well. It's just exacerbating things.
Absolutely. And in fact, in last year's budget, I created a $10 million reserve to create more workforce, to increase the workforce, create more access, and to have a public awareness campaign to hopefully eventually get rid of the stigma associated with mental health and behavioral health issues. We were working on a public awareness campaign with videos and getting, sports figures involved. We were going to release it in May, which is generally Mental Health Awareness Month. Instead, we took some of that money and did a COVID-19 related public awareness campaign. And we had that out in social media for a while. We are back on track now with a major mental health public awareness campaign that we will be releasing this fall.
Excellent.
So I will continue to work on these issues. I realize sometimes things go slowly. Sometimes they go fast, but sometimes they go slowly, and just keep at it until it gets done.
Along the same lines of the things that you say have real impact on people's lives, let's talk a little bit about the transportation, which came up a few minutes ago. You said in another interview that once it's deemed safe to return to work, like before the roads, the bridges, the buses, and the trains are all congested again, and hopefully that will that time of returning will come soon. It's now a perfect time to perform all the repairs and the renovations on our transportation infrastructure. In the Metro West area, one of your first initiatives in the Senate was to advocate for the MWRTA. Now more than ever, that is even needed on weekends, which isn't available on Sundays. And there needs to be improved reliability for essential workers and people who rely on that kind of transportation. What do you feel about the likelihood of those infrastructure improvements happening, those schedules being expanded, and also just the Mass Pike as well? Let's lump it all together and talk about the Alston-Brighton bond bill and the MWRTA and just transportation overall.
Okay, well, as you know, transportation is an area near and dear to my heart.
I do know.
It's something that is so critically important for Metro West. And I believe that for so many years, Metro West, and actually probably most areas west of Boston, were neglected with transportation funding. So it's something I have really fought hard for, regional equity, not only for Metro West, but the western part of the state feels they had been left out, the North Shore, the South Shore. So we need to apply our transportation resources in an equitable manner, and I will continue to fight for that. So the creation of the Metro West RTA fell under that. It used to really get me angry to see transportation dollars and other areas of the state have public buses and not us. So it's just wonderful to see now 14, 15 communities tied in and the fabric of those communities connected because of public bus service. Do we need more public bus service? Absolutely, yes. And I have been fighting for successfully getting increases in funding and resources going to the Metro West RTA. And the head of the RTA, Ed Carr, is really a forward-thinking person, and he has been terrific in getting not only state funds, but federal funds for services, for veterans, for increasing service. And I know they are looking at Sunday service, and particularly now, I think it's so critical. We should have service 7 days a week into the evening, and I will continue to push for that and work to increase the funding.
Thank you for your continued efforts on that. I have so many topics to address with you.
I want to mention with the Alston I-90 project.
Yes, I wanted to talk about that because of the bond bill. I think there was there were a lot of concerns about the mitigation that was going to accommodate the Metro West during a project like that.
Yes, and it seems as if much of the discussion of mitigation has been after they figure out the project. I think mitigation, and I have been saying, it has to be a part of the engineering and design from day one. You can't figure out the entire project and then tack on mitigation. You have to have it apart. So when the administration put in the bond bill, $250 million for design and engineering for this Alston I-90 project, I earmarked $50 million for mitigation. So from day one, they have to present what they are doing with mitigation and build it in. That's the only way to really have a thorough mitigation. And once again, the Metro West Central Mass will bear the brunt of that project. The second thing that I successfully got in the Senate version of the bill that I hope survives, I hope the House accepts, is it includes a provision that tolls cannot be increased to fund this project. The administration must find other ways to fund it. I will not let this I-90 Alston project be funded on the backs of toll payers, period.
Well, and most of the toll payers are in the western part of the state. They're not north and south of Boston. Right. What about the idea of, since you don't have to build toll booths and they're all electronic now and they are aerial, you don't even know they're there. Would there be any consideration of funding coming from tolls being north and south of Boston as well as west?
I have consistently said the mantra, if tolls are, either take down the tolls if you're not going to put them in other areas of the state, take them off the turnpike, or if people in transportation, the administration feel it's such a good idea to have tolls on the pike, put tolls on other major roads, put tolls on our borders. We pay a toll when we go into New Hampshire. They should pay a toll when they come into Massachusetts. It's only fair.
That doesn't get much traction, though, does it?
The one thing the Trump administration has been approving a few other states putting tolls on other roads, and I believe that we should be applying for that as well. So, but the bond bills does include millions of dollars for infrastructure projects across the Metro West. It has some funding for the 126 Route 9 interchange that floods. It has funding for many other critical roads and highways and bridges and culverts in Metro West as well.
You think that once and for all, the flooding on Route 9 at 126 will be repaired and
It is slated
remedied?
right now for I think 2023, a project, and there have been efforts by some of the other communities to push that back to 2024 to take the money for someplace else, and I have consistently fought that as well. So.
Okay. Let's talk for a minute, since we're talking about transportation. I want to just talk for a minute about the Family Work and Mobility Act, driver's licenses for undocumented immigrants. It's been under consideration in one form or another for a decade. Why doesn't that seem to ever pick up momentum to get signed into law here in Massachusetts?
I think that there still needs to be a communication and support. I don't believe that there is full support in the House, and there's still a lot of senators that have concerns. And I think that, again, sometimes things take time. I have publicly stated that I am in support of it, but I think that people still need to better understand this bill.
Let's talk for a little bit about police reform. There's a lot of talk about that these days.
I think that with all that's happened with George Floyd, Breonna Taylor, so many, Yuri Stamps, I mean, so many people of color recently, and it being shown on our computer screens, on our TV. I don't think anybody could watch what happened to George Floyd and not be repulsed by it, and not wanting to just jump and push that officer off of him as he's yelling as hard as he can, "I can't breathe, I can't breathe." And his gasps are getting weaker. It was horrible to watch that. We all have seen and heard the protests, the cries for some change. So I believe that it's time to look at our systems and looking at what can we do to help communities of color, to help keep this system so that policing can take place. We protect the safety and health of our law enforcement officers, our peace officers, but at the same time, help protect our communities of color so that instances like that don't happen.
So you have a racial justice working group.
Well, we passed bills. We passed our racial justice bill, the Reform Shift Build Act. The House passed their racial justice, and it is in a conference committee now. A few members of the House, a few members of the Senate, passing out the differences.
Okay, we'll keep our eyes on that. Let's talk for a minute about gender equality and working women. As you know, especially during COVID, it's become more and more apparent that caring for children, caring for older adults, not having childcare, women making 72 cents or 72 to 80 cents on the dollar, not enough seats on boards and commissions, and suffering with maternal health disparities are all really symbolic of gender inequality in the Commonwealth. What's it going to take to turn that around, and maybe even to support women with passage of the Roe Act in Massachusetts?
Helping women, clearly, whether it be, women of color, any women, and for me to feel as a mentor, hopefully a role model in some ways, has been wonderful. Some of the things I have worked for is over the years, the Women on Boards resolution, trying to get more women on boards, the healthcare bills to look at disparities. I've sponsored that. I was the lead sponsor on the pay equity bill, particularly the piece that prevented employers from asking applicants what their current salary was. That has shown, research has already shown, that has made the biggest impact in inequality and leveling the playing field for women and their salaries moving up. So I am very proud of that. I was the lead sponsor on the paid Family and Medical Leave Act that I'm very proud of. Massachusetts has the strongest bill in the country now. But we clearly need to do more, and we need to keep looking at all aspects of women's health, women's economic status, social status, all different different aspects of life. And we're continuing to pass bills. We recently did the Maternal Health Disparities Act that we passed. All the way to, when I became Senate President, and you've been in my office in the presidential suite, there were pictures of all the prior Senate presidents, and they were all white men. I ended up taking advantage of being a woman Senate President and put up pictures of women who have had a major impact on the history of Massachusetts. And so there are over 90 pictures of very notable women. A lot of them people don't know because there haven't been as much history shown about women in Massachusetts. But you walk around the halls of the State House and women have been left out, whether it be by design or by accident. You would think that women didn't exist over the few hundred years of the history of Massachusetts.
Well, you're changing that.
I am working hard to change that. We were in the process of getting together a commission to put a bust into the Senate chamber of a woman. COVID-19 has put a little pause on that for a while, but there's lots of other things that we will be doing as well.
Mm-hmm. And do you think that the Roe Act is likely to pass in Massachusetts?
I think eventually, or a form of the Roe Act. I know that it's still, it was in committee until July 31st. So the committee extended its staying in the committee. But, we are looking at that and working with the sponsors.
In speaking a little bit about housing and affordable housing, not just not subsidized housing. A lot of people think when you say affordable housing, you mean subsidized housing. And
workforce housing.
Workforce housing, yes. And in communities like Framingham, which has a very dense housing market as it is, there's always the feeling that, and the sentiment that other communities in the Metro West area should also be increasing their housing stock so that it's not all consolidated into one community. What can be done, do you think, for people who are looking to downsize, for seniors that want to stay in their community, for young families starting out? What do you think can be done to not create more development, but to create more workforce housing? Development at $3,000 a month for an apartment to rent is not the kind of workforce housing that the region needs.
Right. Well, we did pass an economic development bill and we had some housing components in it. I don't know what's going to survive conference, so we'll see. I don't want to get into all the pieces until we know what is actually in the final bill. But I'm hoping that there are some pieces in it that will help increase affordable housing on workforce housing in the communities of Metro West as well.
I hope so, because developers are really more focused on their financials than they are on the greater good of the community. So someone else has to be focused on facilitating that for sure. Now, you know that Framingham has a high proportion of social services in the region with many ancillary costs that are associated with that. And do you think that there's recognition of that at the state level with the kind of support and resources that should come into the city for providing those services within the city lines?
Yes, I mean, Framingham gets a lot of support, help, resources from the state, from the federal government for those areas. And I know that myself and Representatives Lewis, Robinson, and Gentile are always on the lookout for more resources for Framingham.
Let me ask you this. If you could pick 3 bills that were passed by the Senate and bypass the House to get them to the governor's desk next week, which ones would you choose?
That were passed by the Senate and in the House or not in the House?
Not in the House.
Well, mental health reform would be a big one. I think that would change the lives of millions of Massachusetts residents. Our prescription drug reform bill, that would lower the cost of prescription drugs. It would cap insulin, the cost of insulin, to $25 a month for people. For many people, insulin is like water. You know,
Yes.
they absolutely need it to live. It would also dramatically change the lives of so many people. For our seniors, they wouldn't have to pick anymore between the purchase of a prescription drug or the purchase of food to eat. That to me is a tremendous advantage, and it would just be a great thing to have. You know, I'd have to think of some other things, because there are other bills to help our children, to help our disabled, to help our businesses. Those are the two that immediately come to mind as being critically important for the people of this Commonwealth.
And it must be frustrating when they seem to be so like no-brainers, that they're sitting there and they can't seem to get all the way through to the House and then to the governor.
Well, you know, we'll keep working. We'll work with the House and work with the representatives. I know that there is a lot of support across the Commonwealth, and you know, the House did a lot of bills as well. So we will keep at it.
Good. Well, it's that collaborative approach, and that actually ends up bringing things to the finish line. So continuing on that vein for sure. What is it that you're looking forward to most?
Right now, resolving our conference committee bills. We have outstanding the racial justice, the transportation bond bill, economic development, housing conference committee, healthcare, which would allow the continuation of telehealth, which is something that has been amazing. End surprise billing. I hear from every constituent, every resident, that it's an absurd and terrible practice of the surprise billing, and to increase scope of practice of some capabilities to increase access. So that is
What do you mean by surprise billing?
You know, sometimes if you go and you have a surgery and you have it and you think it's in network, you go to a hospital, your network, but for some reason, the day you have your surgery, an anesthesiologist is, you know, they pull somebody in, that person could be in your network, they could suddenly be out of your network, and you don't even know it until afterwards. So that could be an additional cost being out of network, and it could be an additional direct cost to you as the consumer, as the patient, that you did not know about. So what we do is we end it and we say, if for some reason that they need to give you advance notice if this is going to happen. So you could say, no, I don't want that. Mm-hmm. And we have a whole process. So it has been something that has ended up costing thousands of dollars to people that did not know that they would even have that additional cost. So we would end that. And so in addition to the racial justice, transportation, economic development, housing, healthcare, we also, I'm hoping the House on Friday passed a climate change bill. So I'm hoping that we get that into a conference committee tomorrow, Thursday as well.
What is it that keeps you up at night?
Feeling that you know, could we be doing more good policy to help the people of the Commonwealth? Even when we finish a bill, it's like, could we have done more? Should we have pressed for? And I realize there's always more to do, but you know, I have to say, even with that, I have to give credit to the senators, the 39 other senators, Democrat and Republican. I have to give credit to the staff in the Senate, not only the staff of the senators who have worked so hard and wonderfully during this pandemic. So much of their time has been spent on answering and working with constituents on either unemployment insurance, on so many issues that have been really emotional and traumatic for people, that the staff have tried to help. The court officers have risen to the occasion, the business office, everybody. It has really made me so incredibly proud to be a member of the Massachusetts Senate. So, I have to publicly thank all of them, and I have to also publicly thank the Framingham and the Metro West delegation for being such tremendous and great partners and collaborators to help get more and better stuff done for Framingham and the Metro West.
Well, thank you. And Senator Spilka, we have just a minute left. And my last question to you is, it's been just over 2 years since you were sworn in as president of the Senate, Massachusetts State Senate, on July 26th of 2018. How do you feel about the past 2 years?
Very excited. I feel it has been a whirlwind from what we expected first coming in as Senate President and starting. This is my first full session as Senate President.
Right.
It certainly wasn't anything that I expected with the major public health pandemic of COVID-19 and the ensuing health crisis and economic crisis as well. But I look forward to helping the Commonwealth come out of this and come out strong. And we will keep working deliberately, methodically to do that on all fronts. So if anybody has ideas, they certainly can contact my office. We are always available and willing to hear any ideas. And I just, as we end, I want to wish everybody good health and stay well to them and their families, I think, and pay attention, socially distance, wear that mask, and wear it properly. It's amazing how many people I see with the mask with their noses still out. You need to wear it properly and socially distance, wash your hands, and if you're not feeling well, quarantine yourself.
And Senator Spilka, please stay well in addition, because we all need you to be well to continue the work that you're doing on our behalf. And we want to thank you. I want to thank you so much for being here today and for covering all these topics so that we can all become a bit more informed about so many critical issues in our lives. Thank you for the work you do, and thank you for being here with me today on the Audrey Hall Show.
And thank you, Audrey, and best to you and your family. And thank you, as always, for having me.
Thank you. You're welcome.